Hello everyone and welcome to our channel. We at Health is Priceless go to great lengths to produce all of our videos with sound and relevant information that truly applies to everyone. None of us are exempt from the concerns or conditions that we address. We do not believe in coincidences, and we feel that there is always a timely reason for viewers to connect with our videos. Before we get started, make sure to subscribe to our channel and leave a comment below saying, "I subscribed." We will do our best to reply as soon as possible. Thank you. High blood pressure or hypertension is often called the silent killer because it usually has no noticeable symptoms but can lead to serious health problems if left untreated. It is a common condition that affects millions of people worldwide, and it significantly increases the risk of heart disease, stroke, kidney failure, and other life-threatening conditions. Both men and women are susceptible to hypertension, but the risk factors, effects, and management strategies can vary between genders. This video will explore what high blood pressure is, its causes, the differences in how it affects men and women, and best practices for managing and preventing hypertension to live a healthy life. What is high blood pressure, hypertension? Blood pressure is the force of blood pushing against the walls of your arteries as your heart pumps blood. When this force is consistently too high, it is referred to as high blood pressure or hypertension. Blood pressure is measured in millimeters of mercury, mmHg, and is expressed with two numbers: systolic pressure, the pressure when the heart beats, over diastolic pressure, the pressure when the heart is at rest between beats. A normal blood pressure reading is typically around 120 over 80 millimeters of mercury. Hypertension is diagnosed when blood pressure consistently measures 130 over 80 millimeters of mercury or higher. There are two main types of hypertension: primary, essential, hypertension. This type develops gradually over many years and has no identifiable cause. It is the most common type of high blood pressure. Secondary hypertension. This type is caused by an underlying condition, such as kidney disease, hormonal disorders, or the use of certain medications. Secondary hypertension tends to appear suddenly and often causes higher blood pressure than primary hypertension. The impact of high blood pressure on health. High blood pressure forces the heart to work harder to pump blood, which can cause damage to the arteries and lead to various health issues. Some of the complications associated with untreated hypertension include heart disease. Hypertension is a major risk factor for coronary artery disease, heart failure, and other cardiovascular conditions. Stroke. High blood pressure can weaken blood vessels in the brain, increasing the risk of stroke. Kidney damage. Hypertension can damage the blood vessels in the kidneys, leading to kidney disease or failure. Vision loss. High blood pressure can damage the blood vessels in the eyes, leading to vision problems or blindness. Aneurysm. Hypertension can cause blood vessels to weaken and bulge, leading to a potentially life-threatening aneurysm. Cognitive decline. There is evidence that high blood pressure can contribute to cognitive decline and dementia over time. Risk factors for high blood pressure. Several factors can increase the risk of developing high blood pressure, and these can vary between men and women. Age. The risk of hypertension increases with age. Men are more likely to develop hypertension before the age of 55, while women are more at risk after menopause. Family history. A family history of hypertension increases the likelihood of developing the condition. Diet. A diet high in sodium, unhealthy fats, and low in potassium can contribute to high blood pressure. Physical inactivity. Lack of regular exercise is a significant risk factor for hypertension. Obesity. Excess body weight increases the strain on the heart and blood vessels, leading to higher blood pressure. Smoking. Tobacco use increases blood pressure and damages the lining of the arteries. Excessive alcohol consumption. Drinking too much alcohol can raise blood pressure. Stress. Chronic stress can contribute to hypertension, especially if it leads to unhealthy coping mechanisms like poor diet or alcohol consumption. Gender. Men are more likely to develop hypertension earlier in life, while women's risk increases significantly after menopause. Race, ethnicity. Certain racial and ethnic groups, such as African Americans, are at higher risk for developing hypertension. How high blood pressure affects men and women differently. While high blood pressure is a common concern for both men and women, there are some important differences in how it affects each gender. Age of onset. Men tend to develop hypertension earlier than women. However, after menopause, women's risk of hypertension rises and may even surpass that of men. Heart disease risk. While both men and women with high blood pressure are at increased risk for heart disease, women with hypertension are more likely to develop heart failure, especially as they age. Symptoms. Although hypertension is often asymptomatic, when symptoms do occur, they may present differently in men and women. Women may experience symptoms such as headaches, shortness of breath, or chest pain, particularly during menopause. Treatment response. There is evidence that women may respond differently to certain blood pressure medications compared to men, highlighting the importance of gender-specific treatment approaches. Best practices for managing and preventing high blood pressure. Managing and preventing high blood pressure is crucial for maintaining overall health and reducing the risk of serious complications. Here are some best practices that both men and women can follow to keep their blood pressure in check. Monitor blood pressure regularly. Regular monitoring of blood pressure is essential, especially for individuals with risk factors for hypertension. Home blood pressure monitors are widely available and easy to use, allowing you to keep track of your readings and identify any changes early on. If you have already been diagnosed with hypertension, regular monitoring can help ensure that your treatment plan is working effectively. Adopt a heart-healthy diet. Diet plays a crucial role in managing and preventing high blood pressure. The dietary approaches to stop hypertension, DASH diet, is often recommended for individuals with hypertension. This diet emphasizes the following: low sodium intake. Reducing sodium intake is one of the most effective dietary changes for lowering blood pressure. Aim for less than 2,300 milligrams of sodium per day, and ideally, limit it to 1,500 milligrams for better blood pressure control. Increase potassium. Potassium helps balance the effects of sodium and can help lower blood pressure. Foods rich in potassium include bananas, oranges, potatoes, and spinach. Eat more fruits and vegetables. A diet rich in fruits and vegetables provides essential nutrients like potassium, magnesium, and fiber, which are beneficial for blood pressure control. Choose whole grains. Whole grains like oats, brown rice, and whole wheat bread are high in fiber and can help lower blood pressure. Limit saturated and trans fats. Reducing intake of unhealthy fats can help lower blood pressure and improve heart health. Opt for healthy fats found in olive oil, avocados, and nuts. Reduce added sugars. Limiting sugary foods and beverages can help manage weight and lower blood pressure. Maintain a healthy weight. Being overweight or obese increases the risk of developing high blood pressure. Even a small amount of weight loss can have a significant impact on lowering blood pressure. Focus on achieving and maintaining a healthy weight through a combination of a balanced diet and regular physical activity. Engage in regular physical activity. Regular exercise is one of the most effective ways to prevent and manage hypertension. Aim for at least 150 minutes of moderate intensity aerobic activity, such as brisk walking, cycling, or swimming, each week. In addition to aerobic exercise, incorporating strength training exercises at least 2 days a week can further help control blood pressure. For those new to exercise, start with small, manageable activities and gradually increase the intensity and duration over time. Even activities like gardening, dancing, or taking the stairs can contribute to overall physical fitness and help lower blood pressure. Limit alcohol consumption. Excessive alcohol consumption can raise blood pressure and contribute to other health problems. It's important to drink alcohol in moderation. For men, this means no more than 2 drinks per day, and for women, no more than 1 drink per day. Reducing or eliminating alcohol consumption can have a positive effect on blood pressure levels. Quit smoking. Smoking is a major risk factor for high blood pressure and cardiovascular disease. The chemicals in tobacco can damage the lining of the blood vessels, leading to narrowing of the arteries and increased blood pressure. Quitting smoking is one of the best things you can do for your heart health. If you need help quitting, seek support from healthcare providers, smoking cessation programs, or support groups. Manage stress. Chronic stress can contribute to high blood pressure, especially when combined with unhealthy coping mechanisms like overeating, smoking, or drinking alcohol. Finding healthy ways to manage stress is essential for controlling blood pressure. Some effective stress management techniques include mindfulness and meditation. Practicing mindfulness and meditation can help reduce stress and promote relaxation. Deep breathing exercises. Deep breathing can help lower blood pressure by relaxing the nervous system. Physical activity. Regular exercise is a great way to relieve stress and improve mood and general fitness. Hobbies and leisure activities. Engaging in activities you enjoy can help take your mind off stress and promote a sense of well-being. Get enough sleep. Poor sleep quality and sleep disorders, such as sleep apnea, can contribute to high blood pressure. Aim for 7 to 9 hours of quality sleep each night to support overall health and well-being. Establishing a regular sleep routine, creating a comfortable sleep environment, and avoiding caffeine and electronic devices before bedtime can help improve sleep quality. Take medications as prescribed. If you have been diagnosed with hypertension and prescribed medication, it's important to take it exactly as directed by your healthcare provider. Medication can be a crucial part of managing high blood pressure, especially when lifestyle changes alone are not enough. Do not stop taking medication without consulting your doctor, even if your blood pressure appears to be under control. Stay informed and involved in your health. Being proactive about your health is key to managing and preventing high blood pressure. Stay informed about the latest research and recommendations related to hypertension. Regularly visit your healthcare provider for checkups and discuss any concerns or questions you may have. By staying engaged in your health, you can make informed decisions and take the necessary steps to maintain healthy blood pressure levels. Conclusion: high blood pressure is a serious health concern that affects millions of people around the world. However, with the right knowledge and proactive approach, it is possible to manage and prevent hypertension effectively. By adopting a heart-healthy lifestyle that includes a balanced diet, regular exercise or physical activity, stress management, and avoiding harmful habits, both men and women can significantly reduce their risk of high blood pressure and its associated complications. Taking charge of your health and making these positive changes can lead to a longer, healthier life. Whether you're already living with hypertension or looking to prevent it, the steps outlined in this video can help you achieve and maintain optimal blood pressure levels for a healthy and fulfilling life. Thank you for joining us in this ultimate guide to understanding high blood pressure, hypertension. If you found this video helpful, please give it a thumbs up, subscribe to our channel, and hit the notification bell so you don't miss any of our future videos. Share your own tips and experiences about high blood pressure in the comments below. Until next time, stay happy, take care, and remember, health is priceless.